Leadership is often portrayed as something that reveals itself in dramatic moments. We remember the visible decisions, the press conferences, and the public victories. Yet the leaders who consistently guide organizations through uncertainty usually share a quieter trait. They spend years preparing long before anyone notices their work. They invest in systems, relationships, and disciplined execution so that when crisis inevitably arrives, people can depend on something stronger than improvisation. That philosophy runs throughout the career of Tina Vidal-Duart, Chief Executive Officer and co-owner of CDR Health and Executive Vice President of CDR Companies. Whether leading emergency healthcare operations, expanding access to care, supporting disaster response, or serving cultural and civic institutions, her work consistently reflects one central belief: preparation creates resilience. The most important work often happens before anyone realizes it will be needed. Healthcare is one of the clearest demonstrations of this principle because emergencies rarely arrive with perfect timing or complete information. During the COVID-19 pandemic, Vidal-Duart helped lead Florida's emergency healthcare operations, including serving as the contracted chief executive officer of the state of Florida COVID-19 infectious disease field hospital system. Her organization also supported testing, vaccinations, treatment programs, and other public health initiatives across multiple states. These efforts demanded coordination among government agencies, clinicians, logistics teams, and thousands of frontline workers operating under extraordinary pressure. What stands out in her reflections is that she does not describe leadership as possessing every answer. Instead, she emphasizes remaining steady, listening carefully, making informed decisions with available information, and ensuring that teams have the resources necessary to continue moving forward. That perspective shifts leadership away from personality and toward responsibility. In complex situations, confidence comes less from certainty than from preparation. This mindset extends beyond individual decision-making into organizational design. Throughout her interviews, Vidal-Duart repeatedly distinguishes between creating plans and creating systems that actually function when circumstances change unexpectedly. A strategy that appears impressive in a conference room may prove inadequate in the field if communications fail, supplies are delayed, or multiple agencies must coordinate simultaneously. CDR Health's operational model reflects that emphasis on readiness. The company provides emergency and disaster health solutions, mobile healthcare, refugee health assessments, laboratory services, staffing support, and integrated healthcare programs for government partners. During recent public health emergencies, the organization reported processing millions of COVID-19 tests and vaccinations while expanding refugee health programs and mobile healthcare capabilities. Those accomplishments required disciplined infrastructure rather than isolated moments of individual brilliance. Her comments about emergency response also reveal an important truth about leadership under pressure. Complexity rarely arrives one problem at a time. Logistics, staffing, transportation, communications, clinical operations, and rapidly changing conditions all influence one another. A single weak link can disrupt an entire response effort. Success, therefore, depends upon building organizations capable of adapting without abandoning structure. Perhaps the most revealing habit Vidal-Duart describes is remarkably simple: pausing before reacting. In environments where speed is essential, taking a brief moment to ask what is known, what remains uncertain, who is affected, and what truly requires immediate action often prevents larger mistakes later. Calm, she argues, is contagious. Teams tend to mirror the emotional tone established by their leaders. This approach challenges a popular misconception that decisive leadership always means acting immediately. Sometimes the strongest decision is creating enough space to understand the real problem before rushing toward a solution. In crisis management, disciplined thinking frequently saves more time than impulsive action. Preparation also appears throughout Vidal-Duart's work outside emergency healthcare. She has emphasized that disaster recovery continues long after headlines disappear. Communities recovering from hurricanes, public health emergencies, or other disruptions continue requiring medical care, transportation, medication access, and reliable information. Sustained support becomes as important as immediate response. That long-term perspective has also influenced newer initiatives focused on women's health through personalized healthcare offerings that address hormone optimization and metabolic care. While very different from disaster response, the underlying philosophy remains remarkably consistent. Identify overlooked needs, listen carefully to people's experiences, and build services around genuine gaps rather than assumptions. The same pattern emerges in her civic and philanthropic leadership. Vidal-Duart serves as chair of the Florida Grand Opera, vice chair of the Miami-Dade Homeless Trust, and a member of the Florida Atlantic University Board of Trustees. Rather than treating these commitments as unrelated volunteer activities, she describes them as part of strengthening the institutions that help communities thrive. Her support for education, homelessness initiatives, healthcare access, and the arts reflects an understanding that healthy communities depend upon interconnected systems. Healthcare alone cannot solve every challenge. Educational opportunity, stable housing, artistic expression, and cultural institutions all contribute to quality of life and long-term resilience. One particularly thoughtful insight from her public comments involves the relationship between arts and well-being. She argues that access to music and artistic expression provides important opportunities for emotional development and community connection, especially for young people. Her leadership within the Florida Grand Opera therefore becomes more than cultural stewardship. It reflects a broader belief that creativity and well-being reinforce one another in ways that benefit entire communities. Her own background helps explain this commitment. Raised in a Cuban-Mexican family in Miami, she has spoken about learning that generosity is demonstrated through consistent participation rather than occasional gestures. That philosophy continues to influence her approach to philanthropy, emphasizing long-term involvement, institutional support, and sustained engagement over symbolic contributions. Another recurring lesson throughout her career concerns teamwork. Vidal-Duart credits numerous mentors, including early professional leaders and her grandfather, Charles Forbes, for shaping her understanding of leadership. Among the lessons that remained with her were the importance of listening more than speaking, working alongside teams rather than above them, and surrounding oneself with people willing to provide honest feedback. Organizations become stronger when individuals feel safe identifying problems before they become crises. This willingness to welcome difficult conversations complements her broader philosophy of preparation. Honest feedback allows weaknesses to be addressed while conditions remain manageable instead of waiting until failure becomes unavoidable. In that sense, resilience begins with humility. Her favorite book, The Pilgrimage by Paulo Coelho, offers another glimpse into this outlook. She describes connecting with its themes of purpose, reflection, and periodically reassessing priorities. That appreciation mirrors a career defined not by constant acceleration alone, but by intentionally stepping back to reconnect with what matters most before moving forward. Modern organizations often celebrate speed, disruption, and rapid growth. Tina Vidal-Duart's career offers a valuable counterbalance. Sustainable leadership depends less upon dramatic moments than upon disciplined preparation carried out consistently over time. Systems are built before emergencies arrive. Trust is earned before difficult decisions become necessary. Teams develop resilience through everyday habits long before extraordinary challenges appear. The quiet discipline of preparing before crisis arrives is ultimately the thread connecting healthcare operations, emergency response, philanthropy, and civic leadership throughout Vidal-Duart's career. Her example reminds us that the strongest organizations are rarely defined by how loudly they respond to adversity, but by how thoughtfully they prepared for it. When preparation becomes part of an organization's culture, resilience is no longer accidental. It becomes the foundation upon which lasting service, meaningful leadership, and enduring public trust are built. Here's a review of what we can learn from Tina Vidal-Duart. Number 1. Build systems before you need them because preparation creates resilience when circumstances become uncertain. Number 2. Stay calm under pressure by gathering the best available information before reacting. Number 3. Measure leadership by how well your team performs, not by how visible the leader becomes. Number 4. Strengthen communities by investing in institutions that improve health, education, culture, and opportunity over the long term.